Good evening, sorors, fraters, friends, and guests. This is Brandy Armstrong with Delta Sigma Theta Sorority Incorporated, the National Technology Committee. We are pleased to present tonight's webinar on our Facebook and YouTube channels for our respective organizations. I will now turn it over to Dr. Charlotte Freeman, National Chair of Physical and Mental Health Subcommittee for Delta Sigma Theta Sorority Incorporated. Dr. Freeman.
Good evening. Good evening. I am Dr. Charlotte Freeman, and I am excited to welcome you to a special edition of our Wellness Wednesday, which is a part of our national initiative on mental health for Live Well. Tonight, we are just excited to be partnering with Johnson and Johnson, but more importantly, we are partnering with the men of Kappa Alpha Psi Fraternity Incorporated. We certainly want to just acknowledge our national president, Elsie Cook Holmes, and our national chair for program planning and development, Pamela E. Smith. We want to right now ask you to call a family member or a friend or definitely a lady of DST. And we certainly ask you to make sure you reach out to the men of Kappa Alpha Psi so that they can join us right now because we're going to have a fabulous event tonight. So we want to make sure that we understand that we are going to have a panel that's going to be talking statistics, the challenges of mental health during COVID, and strategies to help you cope. I am delighted to introduce to Facebook and our YouTube audience my co-host for this evening, Antonio Martez, who is the National Vice Chair for Health and Wellness for Kappa Alpha Psi. Antonio, thank you for joining us on this collaboration with Johnson and Johnson.
Hey, good evening, Charlotte. I am delighted that we are with this opportunity. One of the best things that it's just not coincidental that we're doing this in the month of November, because with the month of November, it's Men's Health Awareness Month.
Well, we are
So
happy to
for
be
all
able
my
to
brothers,
support you.
absolutely. So for all my brothers that are out there, and for all of their silhouettes and all the ladies of Delta Sigma Theta that love the Crimson and Cream as well, make sure that you're speaking to your loved ones. Make sure you're speaking to your loved ones that are men, and encouraging them to be mindful of their health. And then along with calling someone, make sure you're sharing the link on Facebook and YouTube so the others will pick it up. So with that said, Charlotte, I hand it back over to you.
Well, in the world of Delta and physical and mental health, our signature program is called Live Well. And we have, for the past 14 months, we have been working and monthly providing workshops on mental health. We've covered topics such as intimate partner violence, depression, anxiety. We've talked about belonging. What about our faith, grief and loss? So I understand that you have a complimentary program called Brothers Keeper. Could you tell us a little bit about that?
Sorry about that, Charlotte. So with mental health being one of our platform initiatives, we are always out to make sure that our brothers are okay. One of the things that our Grand Pole Mark and our past Grand Pole Mark, and I must say, bringing welcome on behalf of our 35th Grand Pole Mark, Brother Jimmy McMichaels. He is extremely passionate about health and wellness within regards to our fraternity. And one of those things and key things is mental health. So we just want to make sure that our brothers are okay in this difficult time, along with what we're dealing with. With stress of being the head of household and everything that comes from being a black male in America. We just want to make sure that, hey, you're okay. And if you're not, it's okay to be not be okay. We just encourage our brothers to speak up and to be, be courageous to let someone know what's truly going on.
Love that our organizations recognize that within our communities, we really need to ensure that we have mental wellness. And I'm glad that we're at the forefront. And many of our other D9 organizations are as well. But we have something else in common. What about this Good Health Wins? We both are involved in Good Health Wins. We are, in fact, that's really part of why we're even having this workshop tonight, right? We're talking about mental health in the era of COVID. And I know both of our organizations have worked really diligently to inform the community, encourage them to be aware, wear their mask, even though they may think COVID is over. We know it's not. So I know that within Delta, we've been giving out seed grants to our chapters at a minimum of $1,000 to help educate their communities, health fairs, panels, table events, creating video infomercials. Pastors have signed on with us, health professionals, and just really credible messengers within the community. Tell us about what Kappa's doing.
So just like Delta, Kappas have embraced this movement called Good Health Wins. We're doing just things similar to what you're doing in the communities. We've established a mini grant program where we incent our alumni chapters as well as our undergraduate chapters to promote vaccine awareness. And then one of the things that we do with regards to our undergraduates to encourage them to spread the message on their campuses is we created an ambassador program where our undergraduates are the eyes and ears of our fraternity, and they speak to other undergraduates, they speak to alumni members. We send them to our national leadership conferences where they speak on the program. I mean, we have truly embraced Good Health Wins. And so I'm not sure if you know, but it was Kappa that coined the term, we're all in for Good Health Wins. So we're truly vested, and we love this program, Good Health Wins.
Well, you know what? I'm going to let you have that. I'm going to let you have that. That is absolutely, I love that. And to know that we're all as a D9 organization and other civic organizations are working to make sure that we are healthy, that our families live, that our communities thrive. And we're just two organizations in a big pool of people who are working to make sure. So we really want to expand this conversation. You've heard Antonio and I talk about what our organizations are doing, but let's hear from some real professionals. We have a phenomenal panel. Brother Antonio and I have worked together to try to outline this along with Johnson & Johnson, who wanted to make sure that we were coming together to promote mental health and wellness. So leading this charge and being the moderator, the incomparable Dr. Jabbar Swank. And he is he's a medical executive at Johnson & Johnson. So knowing that he and Johnson & Johnson wanted to make sure that they were a part of this conversation with Kappa and Delta and all of our friends in Facebook land and YouTube. Dr. Swank.
Terrific. Thank you, Dr. Freeman, and good afternoon, everyone. I bring you greetings from Johnson & Johnson, but also as a Fall 2000 initiate of the Zeta Iota chapter of Kappa Alpha Psi Fraternity Incorporated. And I'm excited to be here and to provide support in the way of a moderator for this outstanding program. But to set this tone, I want to make sure that we understand how the global mental health landscape was impacted profoundly by COVID-19. And it brought to the forefront vital issues of mental health being. Our societies have faced a cascade of challenges, with many individuals grappling with heightened anxiety and a rise in mental health conditions such as depression and PTSD. And this has been acutely felt among young people and women who have borne the brunt of isolation and disruption in their life patterns. And so as we delve into today's panel, hosted by Delta Sigma Theta Sorority Incorporated and Kappa Alpha Psi Fraternity Incorporated, We will explore the multifaceted impact of the pandemic on mental health, particularly among communities of color. We will also examine disparities in mental health access, the influence of systemic issues like racism and socioeconomic inequality, and the potential of digital interventions to bridge gaps in care. And so with that said, as I mentioned, I'm Dr. Swain, a medical executive for health system integrations at Johnson & Johnson, and a proud sponsor of this webcast alongside Delta Sigma Theta Sorority Incorporated and Kappa Alpha Psi Fraternity Incorporated. But we'd now like to give this conversation over to some of our panelists who are esteemed guests that have backgrounds deeply rooted in mental health. And so without further ado, I'd like to bring to the screen our esteemed panelists to participate in this conversation. Terrific. And so with us we have Dr. Broughton, Dr. Williams, and Mr. Sams. And I'll each have them introduce themselves, and then we'll take a deep dive into their mental health background and their experiences with COVID-19 and mental health, particularly among communities of color. We'll start with Dr. Broughton. Could you bring us greetings, sir?
Good evening, everyone. It is a proud moment that I represent Kappa Alpha Psi Fraternity Incorporated and bring information to our communities that is so needed in terms of mental health. I am the Vice Chairman for Mental Health and Wellness of Kappa Alpha Psi Fraternity Incorporated. I am a practicing psychiatrist and medical director of a community mental health center. I am so proud of the fact that our fraternities and sororities have taken the issue of health and wellness for our communities totally and providing leadership in that regard. Thank you very much.
We'll now bring Dr. Williams to the stage.
Dr. Williams, I believe you're on mute.
Okay. Hi, I'm Dr. Jackie Williams. Again, I'm a psych clinical nurse specialist, and I'm a member of program planning and development for Delta Sigma Theta. I also am clinically employed as a clinical nurse at Alameda Health System, John George Hospital in San Leandro, California. Welcome.
And next we have our therapist, Mr. Sams.
Good evening, everyone. My name is Jarvis Sams. I'm a member of Kappa Alpha Psi Fraternity Incorporated, fall 1992 Epsilon Mu chapter, which is Florida Memorial University. I've been a mental health professional for the last 12 years. And along with my wife, we own our own counseling program where we've been dealing with mental health for the last 2 years in a private practice setting. Thank you so much.
Awesome. Well, thank you, guests, for introducing yourselves. And so now we'll just jump right in. And so as well known to many across the country, the COVID-19 pandemic presented very unique challenges. Many of us have faced them from a physical perspective. Often many have faced them from a financial perspective. But something that we all can't really see or touch is the mental aspect. And so I know each of our panelists probably have an opinion about what the, construct of how mental health has been affected and engaged with the COVID-19 pandemic. And so I'll start with our first guest, Dr. Broughton. Can you share with us a little bit about your experience with COVID-19 pandemic and how the social and the economic stressors have uniquely impacted the mental health of people of color during this very tenuous time?
Yes, sir, Dr. Swain. Being the medical director of the Community Mental Health Center, one of the things that we noticed initially was the fact that, as you mentioned before, the social isolation. when the pandemic came into being, the fact that people were limited in terms of going places because of the fear of going out and getting the virus, it led them to remain home. And with social and economic disparities, as we know, a lot of people did not have the opportunity to get on a computer or even touch base with a medical professional because they did not have the means to do so. With that being said, when people started going to see their physicians, there was a lot of telemedicine going on initially during the early stages of the pandemic, which made it difficult for a lot of people because people in lower socioeconomic situations just didn't have the means to get on telemedicine. So they basically stayed at home and prayed. The unfortunate part about that is the fact that being socially isolated like that, not only were they missing the main aspects of their healthcare with all their healthcare providers, they also were missing a vital component of mental health wellness, which is social interaction with people. The fact that they're not able to interact with people carried a significant burden on a lot of people who depend on social construct to basically be well.
Terrific. Thank you, sir, for that commentary. And we'll now kind of bring it over to Dr. Williams. I know that in your work, you are really interested in, understanding the stressors that are involved in mental health. And one thing that was clear through the pandemic is that a lot of disparities were uncovered. And I'd like if you could give us a little bit of kind of a peek under the hood of what disparities have been observed in the access and quality of mental health care for communities of color during the pandemic, and what are some things that you think can be done to help mitigate some of those disparities?
Thank you, Dr. Swain, for that question. We know that in African Americans that they are disproportionately um, affected by risk factors that link them to mental health, such things as poverty, homelessness, violence, just to say a few, which are significant challenges in their attempts to actually access quality mental health services. According to the NIMHD, Black Americans currently experience mental health about 20% of the time, more than our white counterparts. Some of the major barriers or stigmas, barriers or cultural stigma, we'll start there. Cultural stigma is a huge barrier in the African American community and people of colors, because we've been taught that we're weak if we seek mental health treatment. We tend to go to our pastors, our clergy, our family and friends, and other trusted messengers instead of actually seeking out quality mental health care. And it's been a long history with that. High cost. Mental health is not cheap. High cost and insurance limitations are barriers to mental health. Even if you have insurance, there's always sometimes exceptions to getting quality mental health care at the level that one needs that care. Thirdly, there are things like provider bias, inequality of care that we find. We don't always see individuals in psychiatry that look like us. Many folks want to go to providers that look like them. So that number is very low. According to American Psychiatric Association, there's less than 5% of psychiatrists that look like us. And sure, that number is also low in terms of psychologists, marriage and family therapists, as well as advanced practice nurses. Those numbers are very low. So trying to find a culturally relevant, culturally appropriate type of professional to treat them is really difficult still in this day. You wouldn't think it is, but there's still a lack of diversity there among mental health providers. Also, there's difficulty navigating the process. It's not easy trying to find a provider, seek a provider that's really culturally relevant, and a lot of negative past experiences that African Americans have encountered as it relates to not only mental health care, but physical health care. And then a lot of emotional hesitation, really, do I really need help Do I really need mental health care, or can I wait? Can I go see the clergy? So those are some of the bigger pieces there in terms of those barriers.
Terrific. Thank you for sharing that. And so, you know, from what you just shared, Dr. Williams, it feels like you're saying that the pandemic exacerbated existing disparities and increased exposure to stressors such as job loss, economic hardships, and discrimination, all of which have a significant impact on mental health. Moreover, we also saw increased racist attacks and xenophobia, especially against Asians and Pacific Islander communities, particularly in the context of thinking that they brought COVID-19 over to the US. And that added to psychological trauma that was experienced during that period. And so I'm going to now turn it over to Mr. Sams and ask, can you share with us a little bit around, you know, systemic issues such as racism and socioeconomic inequalities that could contribute to mental health challenges that people of color face?
Thank you, Dr. Swain. I think this goes back a long ways, not just with mental health, but as my colleagues actually said earlier, it's just health in general, and it goes back to the Tuskegee experiment and breaking down our ability or inability to feel comfortable in a health space, and who can we trust. So access also is about trust. Can I trust this person? That's the reason why we look for someone that looks like us. Oftentimes, it's not only the high cost, but it's the trust aspect. And so what I've learned in my private practice was I had to find a way to bring costs down so that I could be approachable and accessible to my clients and the clients that were out there. Now, unfortunately, we're unable to serve everyone, right? But the reality of it is that's something that has to happen. We have to figure out ways and different ways. So just culturally, it's just been so many things that we've faced out here in the field. In the last 3 or 4 years has been very interesting in the way that people have gotten access to this. So that's a component that really needs to be discussed and considered as we move forward.
Awesome. Thank you for that. Now we're going to kind of turn the conversation in a different direction. And Dr. Broughton, you actually brought this up when you gave your introduction around the influence or the importance of telehealth and digital interventions. And so if you could, can you just maybe double click on that a little bit for us and help us to understand how have telehealth and other digital interventions have utilized to reach and support communities of color with mental health services during and kind of post-pandemic?
Sure, sure. One of the things that we initially tried to accomplish was getting back in touch with the people that we were seeing prior to the pandemic. When we talk about social isolation, most people that I deal with personally with serious mental illnesses, they isolated themselves anyway. But people with depression, which is not as serious as mental illness as schizophrenia or some of the other very serious mental illnesses, people who become depressed isolate themselves more often than not. And people with anxiety tend to isolate themselves because they don't want to feel more anxious. So getting back in touch with those people was vitally important. One of the things that we did as a fraternity was we had a wake-up call. I said, we are our brother's keeper, and we have to call our brothers and check on them on a regular basis, just because that social interaction that they were getting every month at frat meetings and various other types of get-togethers was missing. And some people, that's the most social interaction they have in their life during those times anyway. And when they are socially isolated, the depression that they didn't were working their way through with various other coping means, it just wasn't there any longer. So when we had telemedicine and communications, at first we did telephone calls, which kept us in touch with people. But then when they were able to get a little bit of instruction on how to use most people have cell phones, how to use the the visual aspect of the cell phone to do telemedicine, they were very happy to get that interaction with their therapist again and also with physicians again. So it became vitally important to open up their lines of communication and let them know that they're not out there alone and that somebody is working on ways to keep them engaged and treated.
Terrific. Thank you, sir. That was very well said. And, you mentioned that, there were some patients who had, serious mental health issues. And I'm wondering if Dr. Williams can give us a little bit detail around what are some notable conditions that were seen to be increased by the pandemic, and maybe maybe from your experience, some ways in which you recommended they seek help or treatment for those conditions.
Thank you, Dr. Swain, for that question. According to the data that I looked at and some of the research that I looked at, the two major ones that have increased, mental health conditions that have increased during and since COVID, one is depression, which has gone up to almost over 30% now, and the other is anxiety. Those are the two biggies. Prior to the pandemic, I think depression and anxiety was around 8.5%. So you see the numbers have tremendously gone up. And of course, we can't leave out PTSD. That seemed to have gone up also for a number of reasons. Because, as we know, during the pandemic, folks lost their jobs. We had an increased job loss that was therefore a decrease in income, more stressors around homeschooling their children, and not being able to get out as much, the whole social issue around social isolation. So of course the anxiety and depression went up quite a bit. Looking at some of the factors that relate to that, again, not being able to socialize and be with other individuals, and you add the complexities around trying to access appropriate and culture sensitive mental health care, which many people don't want to do in terms of the African American community. So those numbers, I can see why they also went up. Also, separation from family and friends, which are factors. Being socially isolated, being in your home, not being able to go out and participate in the things that you participated in the past. And also, in many instances, living in overcrowded conditions in your home because everybody's at home now. Nobody's out in the community. So that increases the emotional stress for families. And on top of that, not being able to check on grandmama or mama or aunt or uncle who's at a distance and worrying about what's really going on with them because you don't want to expose them to COVID as they age because they're at a higher risk. So difficulty knowing what's going on with family and friends also increases anxiety and many times the depression because you're not, again, around other people, and it really increases your ability to be sad and be alone. And some of the data has also talked about suicidal tendencies and suicidal thoughts going up during the COVID. Then on top of that, we had all the issues around George Floyd and all the other killings that would occur, virtual kinds of things that we could see on TV because we were at home. So we're being exposed to all of those traumas, as you will, as we're sitting at home. All of those things impact anxiety and depression. So those numbers have tremendously gone up in both adults and in some instances, our children.
Terrific. Thank you, Dr. Williams. And so, Mr. Sams, with that information that Dr. Williams has shared, it appears that we have an increase of some mental conditions that are disproportionately affecting people of color. And so I'm going to ask you, in your opinion, what are some systemic changes that are needed to ensure equitable mental health care and support for people of color? And how do you see a way forward in order to help mitigate some of the disparities that we see?
Great. Thank you so much. So I'll piggyback in this way and start where I left off about access, right? So if you can give people access, so the depression has gone up. I believe Dr. Williams said that it's 30%. The data shows 30%, right? Which is what the data has been showing us, and anxiety as well. Talk therapy has been known to help with depression. It's actually, you don't need medication. You can actually go to a talk therapist. That's what I am. I'm a talk therapist, right? I'm going to help you through that, but you have to first have access. So I'm pivoting in this respect, right? The advent of mental health in the COVID era meant that we had to change the way we did things. So talk therapy was typically done in person. Now we are now doing it via telehealth. Now we have to teach our clients how to do it via telehealth and get them access. So one of the things I did was our video and conferencing feature within our practice management system was free to our clients. All they needed was the app, and the app was free on their phone. So if they had a phone and they had the app, they got access to us immediately free. And that was something that a lot of people found out immediately, like, wow, I can do this video conferencing thing. So access, the depression is easily remedied if you are doing the work that's necessary, and working with your other professionals along the way when someone may need medication. However, talk therapy has been proven to actually do great wonders to help people. So it's just changing the access and accessibility to it all. And humans are naturally social and communal. So that was another thing, getting them together, right? Making sure that they had someone to talk to. And I love that Brother Broughton said that point of, like, we found a way to come together as far as whether it was in frat meetings or in other social aspects. Other people were there, like, hey, I'm a former college athlete. I couldn't play basketball with anybody. So I'm literally outside playing by myself because I can do this. But, so you have to figure out ways to actually get out and be available to people and be accessible, because we are communal. We're not supposed to be cooped up in a cage, if you will. That is our home.
Awesome. So, if I could summarize, Dr. Broughton opened us up and talked to us a little bit about how telehealth and digital health was paramount to helping to enhance access. And then Dr. Williams gave us a background on the increase of incidence of anxiety, depression, and PTSD, something that many of us, probably can relate to, not only from childhood trauma, but also trauma and stress from our everyday life. And then, Mr. Sams, you brought up some really important points around access and making sure that individuals are aware of where services are, and if we can systemically avail more access to everyone, that will help mitigate some of the disparities. Well, there are some questions that are coming up in the comments, and we are at the half-hour mark, and I want to make sure that we give our audience an opportunity to get some of their questions answered. And so, if it's okay with my panelists, we will turn to the chat and take a few questions there, and I'll give you all three the opportunity to take an opportunity to address those questions. And so, it looks like first question up. My daughter was at the class of 2020, and her class lost graduation ceremonies, internship opportunities, and jobs. They feel like the forgotten class, and depression and anxiety is high. I'm at a loss as to how to help keep her moving along. Any recommendations? Who'd like to take that? Mr. Sams, how about you?
Yes. So one idea is, I would say, oh, got to echo. Hopefully that's better. One of the things I would say is, first and foremost, I understand that is something that I have been dealing with personally, working with clients. One of the things we wanted to do was get them back out into the community. What has happened here in California with some of the classes, what is that they've been able to go back and experience their senior year with the previous class or the previous classes. I'm actually a professor at a local institution here in Pasadena, and when the class of 2020 actually circled back and actually walked the stage with the class of 2022 when everything COVID started to clear up. So one of the things I would do is say, see if there's a way that she can get back into school and actually working with the institution to try to get those internships. It's not too late to try to reinvent the wheel. Everyone is aware that the class of 2020 has lost out on a lot of opportunities. The second piece is to find a reputable clinician in your area, as well as a mental health professional that may be a doctor of psychiatry or a psychiatric nurse like my colleagues that are on the call with me, and providing information to give access. So one of the things what you want to do is depression and anxiety typically come up from something called the cognitive distortion, which is an idea where you make a mountain out of a molehill. Right. And so COVID was a huge mountain. I'm not going to call it a molehill, but we have to understand that molehill or that mountain is we can conquer that mountain. And it's just thinking and talking back and saying, OK, this was just a blip in time. There have been pandemics before, but nothing like this, where we all had access to technology and knowing all this stuff. You can think about all the pandemics that have happened previously. We have to imagine there was some similarities to this, but not the same way, because not everyone is educated. And I think most of us are educated and we have more information. So I'll stop at this point. Thank you.
Terrific. And we have a number of questions coming in. I'm actually going to ask Dr. Freeman's help to corral some of these so that we get everybody's questions. So, Dr. Freeman, would you mind pulling the next question, please?
Yes, and actually, it's related also to children, and they would like to know if the panel could touch on the mental health impact on children during the pandemic.
Dr. Broughton, do you mind taking that question for us?
Sure. Well, children, unfortunately, and it's fortunate, in my opinion, they're more social than adults, and they need each other. They need to be around each other for not only because uh, communication is the best source of learning anything. Education, communication is a must. But children also develop that in terms of their developmental, the aspects of their lives. They learn how groups work and how to cooperate and how to work as a team and how to get along. And so it affects children significantly to be isolated, because if they don't have that social interaction with their peers, the parents can't teach them everything about life. I wish we could, but they actually learn a lot from each other in terms of how to get along, and they don't have to get along with parents and uncles and aunts and grandparents and everything. We just love them, and that's all we have to do. But in terms of that social interaction and learning how to be around others, they have to be together, and they have to have that social interaction in terms of that development.
No, thank you for that. Mr. Sams also commented on the importance of communal and being social. Dr. Freeman, what's our next question that we have up?
Okay. So, in addition to COVID, can the panel discuss mental health concerns in individuals with long-term disabilities? And we'll say in relation to COVID. What has been the impact for those who have long-term disabilities?
Dr. Williams, you mind helping us with that question?
Okay. In terms of individuals with long-term disabilities, we know it depends on the disability. There are multiple types of long-term disabilities, but it is known that individuals that already have a disability are probably at an increased risk for COVID, depending on what that disability is. Again, one that has disabilities already has some stressors trying to deal with that disability in itself. So you got increased stresses there, which is not healthy overall in long term. But they would probably be at the same risk factor as other adults within their age category. So, and again, depending on the disability, long-term disability, if something is a chronic illness, like a heart disease or diabetes or rheumatoid arthritis, which increases inflammation in the body, you're at a higher risk because you got these comorbid conditions. So the data does say if you have additional chronic illnesses, you're at a higher risk exposure for COVID. So that is a fact. In terms of how one manages that, again, I encourage people, as everybody else encourages them, to get all the vaccines they're supposed to get as it relates to COVID, which also decreases their risk, and to not be exposed in a large rate to those people who, particularly those who are immunocompromised. If you're immunocompromised, you don't want to have exposure. So you want to isolate yourself or wear a mask to keep yourself from being exposed. So that's my comments on it. Dr. Broughton might have some additional comments.
No, that's exactly
Anything to add, Dr.
that's
Broughton?
exactly correct. Sure, that Dr. Williams, that's exactly correct. You're at greater risk of developing more depression or anxiety with more complications that you have in terms of anxiety, with more of the new stresses that are placed upon you with possibly getting COVID, but also you're more likely to become more depressed, which can affect your physical health. A lot of people don't understand that long-term depression and anxiety can affect your physical health greatly. And by having these additional stresses placed on the body, it just puts you in more risk in terms of your mortality.
So with the comment about, affecting physical health, there is a question of death. Uh, and it's something that's inevitable to us all. And so, what if you have someone with deaths, back to back, and their ability to manage throughout the pandemic? Mr. Sams, do you have help individuals cope with that experience, understanding how to deal with multiple deaths, and continuing on with their own work and life?
Yes, Dr. Swain. Grief is well, wow. Okay, there's a delay. I apologize, y'all. So yes, grief is a reality with COVID. I mean, so many people passed away at the advent of COVID at the beginning. It happened so fast. So one of the things I would speak to you about is you want to reach out to someone in the mental health field that deals with grief. There's a person by the name of PhD by the name of Dr. Kubler-Ross who came up with something called the 5 stages of grief. We all cycle through those 5 stages of grief at some points of the time. Right now off the top of my head, I'll be honest with you, I can't remember them, but I know that one of them is guilt. One of them is acceptance. You go through anger. You actually go through all those steps. So whenever you lose someone, whether it's during the era of COVID or just in regular life, you're going to go through those stages of grief, no matter, where it is. So you have to have someone to help you process that grief and put it into the right perspective. One of the things I would share to that person, as right now on this panel, would be keep in mind one of the biggest parts of life is death. It's going to happen. It's inevitable. If we all could live for the rest of our lives, we will want to, but the reality of it is death is a part of life. So that's the acceptance of the grief and acceptance of the death is a proper way and a positive way to move through. And of course, that sounds really maybe morbid for me, but one of the things I've personally had to deal with death in the last 2 years myself. So you have to process the actual death and the grief so that you can actually move on and you can be there for others and be and have a wonderful life. And so that's one of the things I would say to that one. There was another good question, Dr. Swain, that was right below that one. Hopefully you saw it. So
Yeah, I'm going to ask Dr. Freeman to bring it up for us while we move to the next portion of the segment. Dr. Freeman.
Okay, so the question that he might have been referring to was some people find the process of locating a therapist to be difficult. Do we have any tips for how do you find the right therapist for you?
okay, so this is my wheelhouse. So I'm going to help everybody out. I hope everybody has a pen and a pad down. Write this down. First place where you want to go is Psychology Today. Psychology Today. You can actually drill down to your actual zip code. You can then put in that you're looking for an African American mental health provider, and that will actually provide you an African American mental health provider. If you don't see that, you can drill down to Latino, or you can drill down to someone else of a color. If you can't find someone in your area, that's a good way. There are other options for someone has a lower income and they're struggling. There's something called Open Path Collective. Open Path Collective allows you to pay about $50 or $60 annually. It's just it's a one-time fee. Excuse me, I take that back. It's a one-time fee of the $50 or $60, but it gives you access to the same thing that you would on Psychology Today. However, these people are in sliding scale fee. The sliding scale starts as low as $30 a session and goes no higher than I think $80 a session based on your income. If you are making $200,000, obviously, then you're going to be well over the $80. But if you're lower income and you're on a fixed budget of $20,000 or $30,000 annually, the $30 comes into play. You get mental health clinicians like myself who actually will be on Open Path Collective, who would make ourselves available to you at that $30 a session, because we have other people who are paying us higher. We're able to offset the amount. Black male mental health is another space that you can go onto on Instagram. Black Girls Therapy is on Instagram. There are numerous ways that you can actually find access to this. And the I believe, and don't quote me on this one because I'm not on the Black Girl Therapy site, but I believe they even give vouchers. So you go on that thing and they actually pay for your mental health. They'll send a voucher. You just send the voucher over to your mental health clinician. The mental health clinician sends it to these people, and they pay the mental health counselor. So those are some tips that I would have for everyone right now. There's access everywhere. I had someone today because he saw that I was going to be on this panel, and he asked me about assistance, and I was like, do you know someone in DC? Well, actually, I don't know a Black male clinician in DC. However, this is what I do have, and I provided him with the same tips. So these are good places to start, and hopefully this will be beneficial to many people, that information.
I would like to add something to that. Obviously, if you are going to a person of color, African American physician, as your family doctor or your primary care person, they would more than likely know people of color or African American psychiatrists, therapists as well. We've all graduated from med school together. We all went to the same meetings and everything. So the your primary care doctor, if he's a person of color, will obviously be able to make that referral too. I work in community mental health, so for people who have limited means, that has been something that I've been concerned about for a number of years. So the community mental health centers tend to have more people who go there that are from lower social and economic situations, and they're able to see a lot of people who look like themselves there that are actually trying to help our people. Now, I can tell you, in terms of finding Black psychiatrists, especially Black male psychiatrists, I finished my residency in psychiatry in 1994, and when I came back home to Arkansas, I was the second Black male psychiatrist ever in the state of Arkansas. And there were only 8 Black psychiatrists in the state of Arkansas. Well, it's 2023, and there are only 11. So that lets you know we're very limited in terms of Black male and female psychiatrists as a whole, as Dr. Williams had mentioned earlier, that they're very limited anyway. So, but I would say your primary care physician would know who is a Black male or female psychiatrist or a therapist or whatever you're seeking in terms of mental health care.
Outstanding. That's really helpful. And Mr. Sam's provided us with a website. We'll make sure that that's displayed on the screen so that people have access to that. And, I just want to also highlight, we had a number of different questions that had the contextual theme of worrying. A lot of people are concerned about that. And I think Dr. Williams and Dr. Broughton, when you all spoke up, you had mentioned that there are different kind of therapies or options available for folks that have depression and anxiety. But what about worrying? Are there some kind of trade secrets that you have when you're engaging patients on how they can cope with worrying, or even to you, Mr. Sams, do you have any books or recommendations that people can use kind of as they engage themselves through the next challenges that they face as it comes to dealing with worry? And
This this is Dr. Williams. The one thing I want to address with that, the basic term worry, is that I recommend folks take care of themselves, practice self-care strategies. One, you start with getting enough sleep. Stop looking and playing video games that are aggressive type of games that also trigger things in your brain. Eat healthy. Avoid a lot of alcohol and tobacco use. Again, limit your screen time and allow some time to relax and recharge. And that's very difficult for some people, but it's very important. You need to have some downtime, some time to just spend with yourself, quiet time to relax, recharge, soak in a bubble bath, take a shower, spend some time to yourself to meditate. And if prayer or faith, whatever your faith is, if prayer is a good thing, faith, whatever your faith or spirituality is, spend some time with that. But take some time for some self-care strategies. These things do reduce your worry, reduce your stress. Um, Focus on positive thoughts. What are some positive things that you can focus on? Um, and then again, use your spiritual support. Those will be the things that I would recommend as it relates to worry.
Dr. Broughton?
That was very well stated, and I totally agree. One of the things that we're stressing in Kappa Alpha Psi, we're stressing not only mental health, but physical health and spiritual health. And those three together make a strong component for a healthy body and a healthy community. So we're stressing as part of our what we're trying to do is in terms of healthy communities is stress mental health, physical health, and spiritual health. So I agree with Dr. Williams totally.
Terrific. And we're going to wrap
I
this
think Dr.
question.
I think Dr. Williams was speaking.
One more thing I want to mention as relate to worry is to make some connections. Remove yourself from social isolation. Begin to make those connections again, because it's very important to have some connections with others and do some things with other folks, families, friends, whatever.
And then any final comments, Mr. Sams?
I'm actually typing two books into the chat. One is Stop Overthinking 23 Techniques. I don't want to read the whole title, but Stop Overthinking. It's a red cover. Hence Crimson and Cream. And then the other one is The Word Cure. Those are two excellent books that I've actually provided to clients personally. They're there, so it is in the chat. I truncated the Stop Overthinking because it's a very long title.
All right, so we have just enjoyed such a wonderful evening. For all those, we had a great moderator. Dr. Swain, you have done just an amazing job for us. We are just excited. You had some last comments you wanted to share?
Yeah, thank you. It's really a pleasure on behalf of Johnson and Johnson for us to be a part of these type of efforts. We understand as a large pharma company and being the largest global healthcare infrastructure in the world that we have to hold ourselves accountable to move the needle and provide resources for people of color in order to bridge the gap and to really make meaningful change in health disparities. And so I'm just gratefully thankful that we have the opportunity to partner with Delta Sigma Theta Sorority Incorporated and my fraternity, Kappa Alpha Psi Fraternity Incorporated, in such a meaningful way. We are trailblazers by our own right, each of our organizations, and what better way for us to partner with Johnson & Johnson and to address some health challenges that people of color face. I think this is the way in which we're going to see meaningful change, and I'm just really excited not only about the opportunity that we had tonight, but the opportunities moving forward in order to bring more resources and enable people of color to be better empowered to take charge of their health. So thank you for having me.
You're muted, Dr. Freeman.
I was about to say, Dr. Freeman, you are talking so wonderfully, but you are on mute.
Oh, we are trying, during this StreamYard, we are trying to make sure we do not have any backup echo. So I was just talking, but I just wanted to say, thank you to our panelists. They have done an amazing job. I know they have sparked your interest because the questions, once they started coming, they were rolling in. And, of course, we could not answer every question tonight, but do know that this only leaves more effort for us to answer future questions through our individual efforts as well as our collective efforts. So we just want to, please make sure in the chat, because they'll go back, our panelists will go back and they will look at the chat. So please give them an emoji so you let them know that how much you enjoyed them. Yes, I want to see the emojis right now. Let them right now let us know that you have enjoyed this webinar that has been presented to you by Delta Sigma Theta Sorority Incorporated and Kappa Alpha Psi. And I'm glad that, you know, Antonio has joined me because we want to just give you our, just the ending pieces for us. I will say, that one of the things that really I heard over and over again is making sure that we're identifying mental health disorders and that we're also making sure that we have access. I want to reiterate that telehealth, in person, and even telephonic, your insurances will pay for that. And I want to encourage everyone in our audience. I heard you asking, and I saw the question about insurance. And we want to encourage you to contact your insurance. The Affordable Care Act was put in place, it's affectionately called Obamacare, was so that all persons who chose to get insurance and could afford it might even be able to access insurance. And one of the major pieces of that legislation was that there was a mental health component. And we recognize that, as many of you, some of you asked, that some of the questions was about, well, the mental health piece is not as robust as the pieces related to our medical care. Well, that is where it is important for us to make sure that we advocate, that we let our legislators know what it is we would like to have and what we need. But I do want to encourage those who have insurance, even if you have state funded insurance, to make sure that you access, reach out, and make sure you know what it is that your insurance offers. Because some of you have employee assistance program insurance, which means that you get some services for free. There are those of you who have children who have state funded insurance. That means that their mental health services are free. So we want to just make sure, and some of you have very small copays. So don't let the cost of care run you off until you know exactly what it is that you have. What is it that your plan will pay for? We want to make sure that we always give you the best information. And for those of you who wonder, well, how do we get this information? That's why we're here. For Delta Sigma Theta, our Live Well program, we are here every second Wednesday at 8 o'clock p.m. Eastern Time. And we have a different topic every single month. So we invite you to come join us on the second Wednesday of every month. Next month, we'll be talking about caregiving. So for those of you who have caregivers out there, we want to make sure that you come in and join us. Antonio, what are your thoughts and what's next up for Kappa in this space?
Charlotte, I must say this has been absolutely amazing. So thank you very much for allowing us to come in your space. You ladies have been doing this for the long haul, and we appreciate the opportunity to be a part. I just want to highlight some of the things that I heard today. There was several isms, I like to call it, that were dropped. We talked about, Dr. Broughton talked about mental, physical, and spiritual health. That's how you make it as a whole individual. Practice self-care strategies, that was mentioned. Emotional hesitation. Uncovering disparities. Social economic disruption. And then, cognitive distortion. And then one thing that we all are still dealing with is how COVID changed the way we do things. As a result of COVID, I've been 100% remote. They decided that they don't need us back in the office, and so COVID kind of showed companies that things can be done in a different way. So there are some goods and some bads that have come from it. But I encourage, like I mentioned, our brothers, I encourage our sisters, everyone, just to make sure that you're being strong. If you're not okay, it's okay. Reach out to your loved ones and just make sure that you're okay. But one of the things that we are actively doing right now is that we're making sure that we bring down the numbers of disparities in healthcare. We're encouraging our brothers to make sure that they're going to see their doctors. We're encouraging our brothers to make sure that they're working out. We have a big platform with regards to physical fitness. Our grand pole mark, Brother Jimmy McMichaels, he ran track at Indiana University where we were founded. And so he is huge on physical fitness. And so as a result, we're embodying that within our body of brothers. So again, Charlotte, this has been phenomenal. Thank you, the ladies of Delta Sigma Theta, for inviting us in your space. This has been amazing.
Well, we are excited that you were able to join us in this space. And who knows, maybe we'll be back together again. We want to thank our technology team. We have the dynamic duo from both of our organizations who have been working behind the scenes, and they have been doing a great job. We want to thank our staff liaisons who have worked along with us to ensure that this would come across seamlessly. And we believe that the Crimson and Cream team have done just that. We thank you for joining us tonight. Again, come back, tune into our pages, go and see our view our websites so that you can be sure that on our Facebook, on our YouTube, wherever you might see our logos and our organizations, we thank you and we invite you to come in and live well. Have a great night.
Thank you so much for joining us on tonight's webinar. We invite you to join us in future webinar sessions as discussed by both of the respective organizations. A huge thank you to the men of Kappa Alpha Psi Fraternity Incorporated and the ladies of Delta Sigma Theta Sorority Incorporated. We hope that you have had some exciting information given and you will take it back and live well. Thank you very, very much and have a great evening.